Hospitalisations have jumped significantly in New South Wales, where the Omicron variant of the coronavirus is spreading fast. Today, there are another 6,394 cases. That's from just over 100,000 COVID tests. It's about 40,000 fewer tests than the daily average for the past week. There were no deaths recorded in this reporting period. 70 more people are in hospital with the virus today than there were yesterday. That brings the total number of patients across the state to 458. The number of people in intensive care remains the same as yesterday. That's at 52. This morning, there are once again huge testing lines at COVID clinics. Many sites have been forced to close in recent days, early after reaching capacity. We're joined now by reporter Jean Kennedy in Sydney. And Jean, what came out of today's COVID briefing?
Hello there, Casey. How are you? Well, as you mentioned, we do have another 6,400 infections. Most of those, we're told, are actually the Omicron variant. It's only about 100 different in the numbers from yesterday's figures. But as you say, the hospitalisations have jumped a little and we're at 458, up from 388. So there's a bit of a jump there. I understand a lot of those people in hospital who are in ICU, which is fairly stable, do have, in fact, the Delta variant, not the Omicron variant. And a lot of those people, we're told, are, in fact, not vaccinated, and they do have the underlying health conditions. But the hospital figures have gone up, which is certainly a concern. And the message that we are getting today from our political leaders, from the Premier and from the Health Minister at today's briefing, is that we are all going to get Omicron at some point or another. So not a terribly encouraging prospect, but probably a realistic one. He said everybody in the state is eventually most likely going to get the Omicron variant. In fact, everybody across Australia will get it, which, even though it's less severe, obviously it has an impact on the workforce, certainly the health front line, as people have to isolate when they do get it. And it certainly has an impact on businesses. So we might have a listen firstly to both the Premier and Dominic Perrottet and the Health Minister Brad Hazzard on that count.
It's very clear from ICU presentations that the majority of people who are in ICU are unvaccinated. That is at a time when 95% of our people here in New South Wales have received their first dose vaccination. So the numbers don't lie. Please go out and get vaccinated.
Bottom line here is that we would expect that pretty well everybody in New South Wales at some point will get Omicron. We're all going to get Omicron. And if we're all going to get Omicron, the best way to face it is when we have full vaccination, including our booster.
So, Jean, obviously today's a very big shopping day across Australia. Could Boxing Day sales see a surge in cases?
Well, I can't see how not really, because we've got thousands of people who have been flocking to the stores since early this morning to do their shopping. Now, there are new rules that come in. As we know, last Wednesday on the back of the National Cabinet meeting, it was announced that both the density limits and the rules concerning QR check-in codes in both in most settings, but certainly hospitality and retail, are being reintroduced from midnight tonight. Now, I did challenge the Premier on this today at the briefing as to why this wasn't introduced, say, from last night, so that it would apply. And his response was that, a lot of those, certainly hospitality, but largely retail, have retained those check-in processes. Now, there is a change that's coming through, and it was just signed off in the last day or so by the Health Minister, and that is that people only have to check in, say if they're going to a big shopping centre, they only have to check in on their way into the shopping centre. You will no longer have to check into each store in that big shopping centre. You only have to do it once. And they say that they're still going to be able to track you down if you just check in. Hopefully people won't be sneaking through that main door, because that certainly would slow things down. But those mandatory QR check-ins aren't officially due to be reintroduced across the board until midnight tonight. So I'm not sure exactly how that's playing out today and how many people have had to check in and how that will go for contact tracers if we do in fact get a surge. Now, the other bit of news that we got today was that another slight change is that if you get a positive test and you isolate for 10 days and you don't get a follow-up text from New South Wales Health, if you have not had any symptoms, you're feeling okay, after 10 days you are going to be free to leave isolation. You don't need to wait for follow-up communication from health authorities. If after 10 days you're feeling all right, those symptoms have gone, you don't have underlying health problems, then you are in fact free to leave. So that's another change that's being introduced today. Of course, a lot of those queues, as you mentioned earlier, for testing clinics are still very heavy, and that's because, again, in the lead up to New Year, there are people who want to go interstate. And if you want to go to South Australia, Tasmania and Queensland at this stage, you still need to get a PCR test. So they're really clogging up the queues here, the testing queues, and those tests are having to go off to pathology centres, and they have to be checked. So that puts a real burden on the system. Now, Queensland said from January, rapid antigen tests, they're considering that they should be okay from January. But the other states haven't really conceded anything on that front at this point. So there's still PCR tests required on that front. So we'll see what comes out of the Boxing Day sales and any potential surge in cases.
Jean Kennedy in Sydney, thanks so much for the update.